As a weight loss doctor, I see firsthand how exciting and overwhelming it can be to consider GLP-1 medications like Ozempic, Wegovy, Zepbound, or Mounjaro. These medications are everywhere in the news and social media, promising dramatic weight loss and even better blood sugar control. But before you jump in, let's have an honest conversation about what you should know and fully understand before considering or using GLP-1 medications under medical guidance of your doctor. This isn't about hype or fear, it's about science backed facts and real world experiences that can help you get best results on GLP-1 medications. Hi, I'm Dr. Bazgha Khalid, and I prescribe GLP-1 medications all the time in my clinical practice to treat obesity and type 2 diabetes as a board certified internal medicine and obesity medicine doctor. So hear me out. GLP-1 medications can truly be game changers, and I have had hundreds of my patients who are in better metabolic health due to these medications. For many people struggling with obesity or type 2 diabetes, GLP-1 medications have opened doors that diet and exercise alone could not. But like any powerful tool, these medications come with certain limitations, like side effects you might not expect, myths that can mislead you, and important health conditions where these medications may not be safe. Knowing the full picture ahead of time can save you frustration, discomfort, and even potential harm. In this video, I'll break everything down clearly. How GLP-1 medications work, what is myth versus fact, common side effects, and how to manage them, what to do and what not to do while on GLP-1 medication therapy, when to avoid these medications, and the key questions you should ask your doctor before starting a GLP-1 medication. By the end of this video, you'll feel confident and informed, ready to make the best decision for your health. Let's dive in. Let's start by understanding what are GLP-1 medications. GLP-1 stands for glucagon-like peptide 1, a natural hormone your body makes to regulate blood sugar, slow stomach emptying, and signal fullness. GLP-1 receptor agonist medications mimic this natural hormone. Examples are semaglutide with brand name Ozempic for type 2 diabetes and Wegovy for weight loss, and tirzepatide, which is a dual GLP-1 GIP receptor agonist with brand name Mounjaro for type 2 diabetes, and Zepbound for weight loss. Originally, GLP-1 medications were developed for type 2 diabetes. However, FDA did approve these medications for chronic weight management, as clinical studies show significant weight loss benefit. STEP trials published in New England Journal of Medicine in 2021 showed up to 15% body weight loss with semaglutide, while Surmount trial shows around 22% body weight loss with tirzepatide. Let's talk about GLP-1 medications, myths versus facts. Myth number one is GLP-1 medications are magic diet shot. One of the common misconceptions is that weight loss injections like Zepbound and Wegovy are easy way out or a shortcut, while the fact is that these medications work best with lifestyle changes. Without healthy habits, weight regain is very common, especially once you stop the medication. So think of these medications as training wheels for nutrition. They quiet food noise and make it easier to eat smaller portions, more protein, and less junk. The real goal is to practice these habits while you're on a GLP-1 medication. So even if you come off the medication down the road, the discipline sticks. Myth number two is GLP-1 medications are only for diabetics. Another common misconception is that GLP-1 medications are only for diabetics, and if a non-diabetic is on these injections to assist for weight loss, then they are told that they are cheating the system. While fact is that GLP-1 medications like Zepbound and Wegovy are FDA approved for chronic weight management in non-diabetic adults. Myth number three is you lose weight instantly on GLP-1 medications. You may hear people refer to GLP-1 medications as a magic bullet which fixes things quickly. However, the fact is that it usually takes 8 to 12 weeks to notice significant changes after starting GLP-1 medications. Therefore, patience matters. GLP-1 medications are not a quick fix. Weight loss on these medications takes hard work and consistency. Most people need 12 to 18 months to get to their goal weight. So GLP-1 weight loss journey is not a sprint, it's a marathon. Let's talk about common side effects of GLP-1 medications and how to manage them. Most common side effects are nausea, vomiting, constipation, diarrhea, bloating. These usually improve after a few weeks. Staying on one dose for at least 4 weeks and slow and cautious dose titration helps. Less common but other important side effects are gallbladder issues or gallstones, pancreatic inflammation. Pancreatic inflammation is a rare but serious side effect. And other very small risk for thyroid C cell tumor is another consideration. There's a small risk seen in rodent studies. There is no proven human risk. However, FDA has black box warning regarding these, and these medications should not be used if you have personal or family history of medullary thyroid cancer. So, what are the tips to minimize side effects? Eat smaller meals, avoid greasy foods, especially early on. Hydrate well. If significant side effects or severe abdominal pain occurs, call your doctor or go to the emergency room. Let's talk about do's and don'ts on GLP-1 medications. Do's are start low and go slow. Don't rush the dose increase. Monitor blood sugar if diabetic. Pair with protein-rich meals and resistance exercises. Keep regular follow-ups with your doctor. Don'ts are don't skip dose or double dose if you miss one. Don't mix alcohol as heavy binges can worsen nausea. Don't assume weight loss will be permanent without consistent behavior change. Let's talk about when to avoid GLP-1 medications. It is best to avoid GLP-1 medications if there is personal or family history of medullary thyroid carcinoma or cancer, or MEN2. MEN2 is a short for multiple endocrine neoplasia 2, which is a rare inherited condition where certain glands like thyroid and adrenal gland can grow tumors. GLP-1 medication should be avoided if there is prior history of pancreatitis or severe gastrointestinal disease like gastroparesis, which is permanent slowing of stomach, or pregnancy or planning to get pregnant, or there's allergic reaction to a GLP-1 medication component in the past. Questions to ask your doctor before starting GLP-1 medications. Am I a good candidate for GLP-1 GIP medication based on my health history? Are there any reasons I shouldn't take these medications? How will this medication interact with my current prescription or medical conditions? What dose will I start with, and how will the dose be increased over time? What labs or tests do I need before starting? How often will I need follow-up visits once I'm on it? What kind of weight loss or blood sugar improvement should I realistically expect? How long will it take before I notice the results? Do most patients stay on this medication long term? What are the most common side effects and how can I manage them? What symptoms are red flags where I should call you right away? What should I do if I cannot tolerate the medication? What are the foods, drinks, or habits I should avoid while on these medications? Should I change my diet or exercise routine to maximize results? How much protein or strength training should I aim for to prevent muscle loss? If I stop this medication in the future, what happens to my weight or blood sugar? What's the plan if I don't respond well to this medication? So, what risks and long term consideration of GLP medications are there? These are weight regain after stopping GLP-1 medication. This is proven by clinical studies. In the step 1 trial extension, people who stopped semaglutide regained about 2/3 of their prior weight loss within a year. Other risks are potential muscle loss. It's best to maintain resistance training and protein intake to minimize muscle loss. Cost and insurance coverage is another concern. Unfortunately, most insurances do not cover weight loss GLP-1 medication injections. GLP-1 medications aren't a quick fix, but they can be a powerful tool when used wisely. Knowing the facts, planning for side effects, and partnering with your weight loss doctor can make your journey safer and more successful. If this video helped you, hit like, subscribe, and share with someone who's considering GLP-1 medications. Your health is an investment. Make it an informed one. Stay healthy, happy, and well. Bye for now.